For almost 100,000 people in the U.S., finding a suitable kidney donor is their only hope of returning to a normal life without painful dialysis to artificially clean their blood several times a week. But there are only about 17,000 healthy kidneys available each year. About 4% of patients on the transplant waiting list die each year before receiving a kidney. Doctors say the number of available kidneys can be increased, but with some additional risk.
We're giving them the opportunity to have a transplant, but we're also treating them for a new infection that they didn't have. So that's the trade-off.
In a pioneering experiment conducted jointly at the University of Pennsylvania and Johns Hopkins University, doctors are offering to transplant kidneys from deceased donors infected with hepatitis C, a virus-borne disease that attacks the liver but leaves kidneys intact. Patients receiving such kidneys are no longer required to endure dialysis, but have to start taking drugs to keep hepatitis C in check. The drugs are not cheap and in a small number of cases may not work. After long talks with doctors about all possible outcomes of the procedure, some patients accepted the risk.
If they didn't have this study, I wouldn't be where I am today. So I'm extremely grateful.
The concept became possible after the discovery of a new and more effective drug that promises to cure 95% of hepatitis C patients. Researchers say if the clinical trials prove successful, hundreds of additional kidneys may become available for saving the lives of patients with incurable kidney disease. George Putic, VOA News, Washington.